the federal government sent me a letter? She goes, yeah, sit down. So I sit down, and this thing was single spaced and bullet pointed, and they had been watching my blog, man. And what they kept saying in every one of those posts, since there's no treatment, prevention, or cure of COVID-19, any mention thereof falls in violation of federal code, blank, 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 blank. Therefore, you are in violation of this federal code.
Hello and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Before we get started, as always, hit the subscribe button. And you can also check out additional information on our website, Instagram, and Facebook. All those links are below. So by now, we've all heard the news of the new COVID-19 variant and potential expanding mask mandates. Mainstream media has already begun their notorious fear propaganda and is saying cases are on the rise. So today we'll be hearing from one of the many heroes of the COVID-19 pandemic who did not cave to the tyranny of mainstream medicine and successfully treated COVID-19 with his protocol. So he'll be sharing with us his protocol, why it works. We'll also discuss early treatment, mask mandates, long COVID, and tips for prevention. So joining me today is Dr. David Brownstein, board-certified family physician and medical director of the Center for Holistic Medicine in West Bloomfield, Michigan. He's a world leader in holistic medicine, lectures internationally, and has authored 16 books that I highly recommend everybody checking out. I will post a link to those below. And if you have not yet watched my last episode with Dr. Brownstein on the importance of iodine supplementation and how iodine deficiency is linked to cancer, definitely check that out. I will have the link below as well. So thank you so much for joining us again, Dr. Brownstein. I'm really looking forward to having this conversation with you.
Thanks for having me, Christy. I'm happy to be here.
Now, take us back to the beginning of the pandemic in 2020 and walk us through what unfolded for you. What did that look like and what the COVID-19 protocol was that you used?
So we'll go back to 2019 in December. And I remember when the first report came out of China that 3 patients were suffering from a novel respiratory virus and novel corona respiratory virus. And I paid attention to that. And then shortly thereafter, more and more people became sick. And into January of 2020, China was suffering massive infections of this and hospitalizations, and deaths were starting to occur. Italy, Spain, a few places in Europe were reporting similar effects. And, then the headlines started that this was a new virus and people were dying. There were modeling through the month of January. They were modeling that by the end of the year, 3 million Americans over 3 million Americans, I think, would be infected, and over 1 million Americans dead from this virus. That was the original modeling out of England. So I read every report that I could on it. Just like everybody else, we were all in the same boat and watching this unfold. We were watching the coroner's trucks in Italy, big trucks to take away the dead bodies. We were seeing those videos in the hospital ICU rooms, those big ward rooms with beds, 2 feet apart, and they're all on ventilators. And the reports are, if you got hospitalized by COVID, you had around a 90% chance of dying from it. So the tension was building, and around the country and in my office, I could cut it with a knife with patients and my staff. And February rolls around, it starts coming to the US towards, I believe, the end of February, and Washington, I think, was the first state that reported some cases of it. And, California came after that. And then in the beginning of March, it hit the East Coast. And Michigan, where I practiced, was one of the first states. Michigan, New York, New Jersey. That's what and maybe Massachusetts, but Michigan, New York, New Jersey were 3 states that reported massive increases in the beginning of March and hospitalizations and deaths. So in my office and in my area, I give a lecture to patients twice a year. once in the spring, once in the fall. It's just about holistic medicine and, you know, where things are and what we're doing in our office. So we had that lecture beginning of March of 2020. The Tuesday after the lecture was on a Saturday. Tuesday after the lecture, the governor shut the state down and, you know, quarantined everybody, and lockdowns happened and businesses closed. So that lecture was Saturday. Thursday before the lecture in my office manager came to me towards the end of the day and said, "You got to talk to the staff." And I said, "What's going on?" She goes, "No one's going to show up for work Monday." I said, "Why not?" She goes, "Everyone's scared." And they're all talking. I'm like, "Okay, let's have a meeting." So we had it in the waiting room. Tension was thick. The newspapers were already saying the governor was going to close us down. There were a couple of hospitalizations in Michigan, and, you know, again, we were, you know, New York and New Jersey were a little bit ahead of us, and they were having more hospitalizations, and deaths have already started. And so we get the staff together. I asked the question, you know, what's going on? And first hand goes up, when are we closing the office down? And I said, why would we close the office? I don't want to die. Came back to me. And I said, you know, we've been treating viral infections and bacterial infections using a holistic approach for close to 30 years. I said, we're pretty damn good at what we do. I said, every year from 20,000, give or take, to about 100,000 Americans die during flu season from a respiratory illness, a flu-like illness. And none of us, my partners and I, can recall any of our patients dying from the flu over that time period. And none of us can recall the last time we had a patient hospitalized from the flu. Now, if let's say an average, 20 to 100,000, let's say the average is 40,000 or something like that. 40,000 times close to 30 years, there's a lot of patients dying from those illnesses. Where are they in our practice? We have 3 practitioners that have been there from the beginning. Now we have 6. We have 3 practitioners over, you know, nearly 100 years of patient care, and we can't recall that happening. So we have been utilizing a nutritional and oxidative protocol for treating viral and bacterial illnesses during flu season for a long time. We've made some adjustments to it as we've learned new things. The basic protocol is the same. Our patients do pretty well. They don't end up in the hospital, and they're certainly not dying from it. So I said to the staff, look, we're a nimble office. We know how to support the immune system. We know how to support people when they're sick. I said, conventional medicine has very little to offer a lot of these viral illnesses during flu season. And the things that they have to offer, like, what's that antiviral, Tamiflu, are not very effective, you know, and there's a lot of side effects associated with them. For most viral illnesses, doctors tell the patients, go home, you know, drink fluids and, you know, rest till you're better. So I said, undoubtedly we've treated about 30% of these infections as coronavirus infections, because that's what it comes out to every year during flu season. And I said, we haven't treated this new SARS-CoV-2 because it's a new virus, but it's part of the coronavirus family. I said, our therapy should work fine. We were given an immune system by our maker for a purpose. The purpose was to get through these and to get memory of these so we don't suffer from them all the time. We didn't have this great immune system given to us, we wouldn't survive as a species. So I said, look, I don't have a crystal ball. I don't know if it's going to work for this one, but we have enough therapies at our hand. We should be able to figure this out. So give the lecture. That was Thursday. We give the lecture on Saturday. The tension is in the air. There's 400 people there, and it was thick, man. And said the same thing to that group. On Monday, I get about 60% of my staff show up for work. The other 40% didn't show up. I told them at that meeting, look, anyone who doesn't want to work, you don't have to work. No one's job's at stake. I understand. And I said, we'll be able to do this. And I said, if no one wants to work, I'm going to work through this. I took an oath, and my oath said, you know, to be there. Well, I felt like my oath said to be there and to be for patients. And this is what I'm working. You know, I'm not running from this, and I need to be there for my patients. And, you know, I've got my own health issues. I've got, you know, severe asthma that I've got under control from my holistic principles and cleaning up my diet and drinking water and eating better. And I used to be on inhalers and steroids and all this stuff, and I'm on almost nothing now. The only time I get asthma is when I get sick with a cold or something. And I take minimal things for it. I've got scoliosis with lung involvement, and I've got no IgA. So I've got an immune system deficiency, which makes me more prone to viral infections. I used to get viruses every month in med school. In my first few years out in practice, I got infections and I got colds, and I'm always walking around with Kleenex, stuffing them up my nose, and I'm always getting a cold. And then I adopt some of these holistic practices, and my colds go away. And I get 1 or 2 colds a year. They're minor, they don't really affect me much, and I move on. So the following week after the lecture, we start working. The governor closes things down on Tuesday. I tell the staff, we're open tomorrow. She said, essential services can stay open. I deem us essential. Patients are going to need us more than ever, I told them. I said, the only thing that's going to be open are grocery stores, ERs, and liquor stores. And I said, patients are going to be scared out of their minds. And if they get sick, they're going to need a place to go. We're going to help them out. So we began treating COVID either the end of that week or the beginning of the following week. And, my staff, I did not want to scare the rest of my staff off. So we treated them outside. It was March in Michigan. March in Michigan is not nice many times. It was cold, it was snowy, it was sleety. It was frequently below 30 degrees with snow on the ground. And we gowned up and put our face shields on and our masks on and our gloves on. And we treated people sitting in their car seats. We had them put their hands out the car door. We gave them our IV therapies. We became masters. My partner, Dr. Ng, was just masterful at teaching us how to do these hand IVs in cold weather. And we had a whole system going on with like an assembly line of making IVs, running out there, giving IVs, having poles, flapping in the wind and the cold as IVs went in people. And we treated them. And, the first week that it started, man, there were some days I remember the cars were like lined up around the parking lot, like 10 deep. And we were working till 9 or 10 at night. We had flashlights going on our phones to see, the veins. And I had, like, if there were passengers in the car, hold their cameras, their phone lights, so we could see what we were doing. And it was a little exciting. I would admit that. It was a little scary at the same time. And wasn't fun is not the right word. It was exciting, and it was, but it was really scary. Yeah. And
it was like that exhilarating, the combination of exciting.
I did not sleep the first week, hardly at all. I'd be jacked up. I'd get home around 10 at night, and we'd work 12 hours or more. And I was too hyped up, and B, I was too nervous. Like, is this going to work? These people couldn't breathe. This was a different, when you put your stethoscope on them to listen to them, it was a different sound than I've heard from people in their lungs from this virus. The air was there, but the air was not being utilized. It was really weird. And, it became, we all felt it. We all listened to it. And after a while, you could just put your scope on people. After a couple breaths, you knew whether they had COVID or not, because it had a different sound than I'm used to with people with other respiratory illnesses and other pneumonias. And so after somewhere in the end of the first week, I started to get calls back, and I would call patients every night. After everybody was sick with COVID, got a call daily until they were out of the woods. And we all did it with our patients. I did a lot of those from home late at night, or, tired, and I wanted to be out of there. But once we felt they were out of the woods, we could stop calling them, but we called them every day. And once I start, a few days into this, I'm calling them, and they're like, reports were coming in, feeling better. And one of the things we did was have them nebulize, we'll talk about it, a dilute solution of hydrogen peroxide and iodine, which we've done for nearly 3 decades for lung problems. And it was really the consistent theme I heard from people was after the second dose of that nebulizer, they could breathe. They felt better. They felt like they were moving forward with the illness. And we had them do it every hour until they felt better. And then I started sleeping. But I'm telling you, that first week, man, it was 2 or 3 hours of sleep. And I remember one of the 2 nights, like I didn't sleep for like a night or 2 in a row, and I'm tired, and I'm working on adrenaline. And the third night, it was like 2 or 3 in the morning. And I don't drink much, but I went down, poured myself a little vodka, and in the middle of the night, I just downed that little shot of vodka to get a couple hours of sleep. once people started getting better, we just continued the work. And we, so what happened was I was blogging about this, and I was posting videos, and I kept, at that time, there's no hope anywhere. The headlines were terrible.
Yeah.
Every news station, CNN, Fox, it didn't matter, conservative, Republican, or Democrat, all reporting death, 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 death. This many dead now. And they had a running counter of dead, like ridiculous. Like, I don't even know. And, it's funny, they had a running counter of death, but there were no tests on people. So we don't really know what they died from because we weren't testing them, although I could listen to them and thought that this was, or the symptoms were consistent, make a diagnosis of COVID, but I wasn't, I didn't have a confirmatory test because it weren't available then.
Yeah.
Where was I going with that? So I was blogging about this, and I was interviewing patients, and I titled the interviews, "There's Still Hope Out There 1, There's Still Hope Out There 2. So as people got better, I'd ask them, could I interview you? And just tell the story. I would interview them. I would ask them an open-ended question, and they'd go. And they'd say, I couldn't breathe. I had a fever. I was gasping for breath. My pulse ox was whatever. And the consistent theme of that story was when I started nebulizing, and, the IVs helped. The consistent theme at home was when I started nebulizing, second or third dose of the nebulizer, they felt better. And they could breathe better, and they felt like they were out of the woods. So I was posting this. There's still hope out there. 1, 2, 3, 4, down the road. I got up to about number 20. And then I come home on a Tuesday night. It was late. It was dark. I was tired, and we were outside in that cold again. And I remember I had my 2 bags in my hand. I got a jacket on. I'm just like whipped. And my wife and daughter were there, and they're looking at the computer, and they got this look on their face, like something terrible had happened. I said, "What's wrong? You better sit down." I'm like, is everyone okay? Yeah, everyone's okay. I said, "Well, what's wrong?" And she goes, "Put your bags down." I'm like, "Just tell me." She goes, "You got a letter from the FTC." I got a letter from the FTC. I said, "What FTC?" She goes, "The federal government FTC, Federal Trade Communication." I said, what did they say? Well, they want you to cease and desist the blog posting. Want you to take everything down. So I said, I'm just standing there, I remember it was late. It was around 9 o'clock at night. And I said, "The federal government sent me a letter?" She goes, "Yeah, sit down." So I sit down, and this thing was single spaced and bullet pointed, and they had been watching my blog, man. And what they said, they kept saying in every one of those posts, where since there's no treatment, prevention, or cure of COVID-19, any mention thereof falls in violation of federal code, blank, 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 blank. Therefore, you are in violation of this federal code. And at the end of the letter, they said, and they went through bullet point after bullet point, and every blog basically. So I said to her, I never said there was a cure. I said, this is how we treat sick patients. It's how we've done the same thing for 30 years. This happens to be just people sick with COVID, but it's the same thing we've been doing. And I never claimed there was a cure. I said, this is treating sick people. And I made it clear on those blog posts. This was.
And you're interviewing them and just asking their experience.
And I said, this wasn't a cure. I said, we were treating sick patients, and they got better. That's what they were interviewing. That's what the patients were saying. So she said, they're calling what you were posting an advertisement. So I read the letter 3 times. I kept saying to her, I don't understand what their complaint is. I was just reporting what we were doing in our practice. She said, they think it's an advertisement and that you're false advertising. That's what it was. I'm like, I wasn't advertising. I never, anyways. Yeah. So we took everything down.
And that's exactly what the world needed, is to hear possible.
Took everything down. I never posted another blog post after that. Never did another interview after that. And we continued doing the work, and that stress happened. And then, there were some other regulatory stressors that came later than that, it was a very stressful time for me and in the practice. And, however, looking back on it, I wouldn't do anything different. I was taught in my training to report your successes and report your failures so other doctors can learn from them. During COVID, so I have two daughters who are physicians, graduated from medical school. My one daughter, Haley's working with me now. My one daughter, Jessie's finishing a residency. She's going to start soon and then full-time in July. And both graduation speeches by the deans of their medical school said the same thing. Report what's working for you and report what's not working for you so other doctors can learn from it.
Right.
So I remember at Haley's graduation, I got those letters, and then, other regulatory agencies sort of came on the tail of that. And he said it, report your successes and I report your failures. And I'm like, yeah, except when it's COVID, be careful of that.
Yeah.
So when I reported that stuff, there was nothing out there but disaster, death. There's no treatment. Wait for the vaccine. Well, telling people to stay at home when they couldn't breathe and wait for the vaccine was not really the best therapy we could have done for them. We had way too many die. And what we should have been doing was researching what works and reporting what works and what doesn't work. But we were prohibited from doing that at that time. And that's where the government colluded with big tech to shut everything down and, basically follow the government's lead on you stay at home, you go to the ER when you can't breathe, and remember, this is 2020. There were no conventional therapies, available, and you wait for the vaccine. And the end of 2020, we had over 600,000 dead from COVID that I believe perhaps didn't have to happen if we just look. I did holistic things. It was a vitamin and oxidative protocol. But the other things we did was we gave people IV fluid who got dehydrated. That's a conventional therapy. That's nothing new out of the realm. And we told people to nebulize with now we used hydrogen peroxide and iodine, but they nebulized with saline as part of that. They could have nebulized with saline to help detoxify their lungs, to help moisturize their lungs so they can get the mucus out of there. And they wouldn't, perhaps there would have been less deaths. I mean, we don't know, but certainly the therapy that was promoted was a disaster. And we should learn from that and never do that again. And here we are 3 years later. We've had, I can't remember the exact, I should have looked before this interview. We had, so I get this letter from the FTC, and in the FTC, they kept, and I posted it. That was the last thing I posted on my blog, was that letter from the FTC. And if you Google my name and FTC, you can see the letter out there. And if you look at the letter, they kept saying someone spent a long time on me, but they kept saying there's no prevention, treatment, or cure for COVID. Therefore, any mention thereof falls in violation of FTC code. And if you don't, you have 48 hours to take all your stuff down, basically, or you're going to hear from the U.S. Justice Department. So we consulted a First Amendment lawyer. I received 2 phone calls after that letter. I posted it. The 2 phone calls were from Robert F. Kennedy Jr. and Del Bigtree.
Wow.
And they called me and said, saw your letter. Let's hear, give us your story, and they both said the same thing. You need to talk to a First Amendment lawyer. So I got referred to a First Amendment lawyer in DC, which, those $900+ an hour. And he basically he was good, and basically says to me, we can fight this. It'll go to the U.S. Supreme Court. I don't know how they're going to rule. And he says, but I recall he said you need, this is going to cost 10 or 20 million or something like that. So he wants $1 million or $2 million. I don't remember what kind of retainer he wanted. It was a couple $1 million or something like that. And he goes, if you don't have that, and I said, I don't. He said, then I would advise either file suit, take everything down, which we'd already done. And if they bother you again, then you got to figure out what you want to do with it. He goes, but he said, it's a good law. False advertising is, a problem, and it's a good law. He goes, they're just misapplying it to you.
Yeah.
And so that, that's where we stood with all that. And, we've, over the 3 years, we've had, I believe, 2 deaths from COVID, 2 or 3 deaths from COVID. We've had maybe 20 hospitalizations. I kept track for a while. We've kind of stopped doing that. Oh, and now we have a couple thousand, thousands of people sick with it that we've treated. Our numbers were way lower than what the statistics were at the time. And I got a call from a few doctors after that letter was posted, friends of mine, who said, the FTC is saying there's no studies, give them a study. So I wrote up a study of our first 109 patients. And according to the statistics at that time, we should have had something like, it's in my study, but we should have had something like 18 hospitalizations and 9 deaths, percentage-wise, out of that 109 back in March and April of 2020. And we had, I don't remember, but I think we had 1 death and maybe 5 or 6, I don't remember now, 5, 6, 7 hospitalizations, way lower than what the numbers were. And then as we got better at this and, firmed things up a little bit, and, we had, our hospitalization rate, went down further, and, we had 1 more death or something in that as it went through. And, we were using steroids from the beginning of this when people had inflammation of their lungs. The government told us not to use steroids.
Yeah.
It wouldn't help at the beginning of this.
Yep.
That was nonsense. We used it from the beginning.
Protocol
and it helped people. I saw it help people. I wasn't going to listen to that nonsense because I saw it. And we used it before the government said anything about it. Then when they came out that steroids shouldn't be used, we already saw it helping. We weren't going to not treat patients, even though the proclamations came out against it. So there were conventional therapies that could have been done early. But I think, our holistic viral protocol helps a lot of people. And, anyways, that's my maybe too long discussion of our travail,
No, not at all. Thank you for sharing all that. I'm not surprised, but I'm horrified at the same time. I mean, I'm a COVID survivor. I went through all that too, almost dying and all that, right? So I mean, it sounds like it's like a GoFundMe type situation where every American should pitch in to do this lawsuit to, get this, shifted around. So this isn't something they can come after doctors for. I mean, this could have saved a lot of lives if doctors were actually, like you said, working together and saying this worked for me and this didn't work, and everybody's sharing information. There was none of that. You weren't allowed.
We should have been sharing information. And, the other thing that's really irritating, years later is that, I don't remember being taught in med school when there's a novel illness that is contagious that you close your doors and you're not there for your patients. And, my office manager beginning said, I think we need to do telemedicine. And I'm like, I don't think that's going to work for me. And she says, well, that's what everyone's doing around the country. And, let's try it. So I said, all right, fine. I'll try it. I'll try a morning or an afternoon, do 1 morning. So we scheduled the patients for telemedicine. After an hour of that, I went to her and said, change them all back. I'm not doing this. It's not good medicine. I can't hear the lungs. I can't touch their neck. I can't look in their throat. I can't, whatever. It's not how I can practice medicine effectively. And I said, and to tell you the truth, I don't think it's good medicine to be doing medicine like that. I think people, you need to touch them. You need to connect with them. You need to listen to them. You need to put your hands on them. It's part of the doctor-patient relationship. It's part of how, I said I was not doing good medicine through telemedicine. And so I did that. I did do it for people who were scared to come in, who wouldn't come in, but it was not my preference to do it. And so we kept our doors open through the whole thing. And we got sick, we didn't get that first wave. What's interesting in our office, we got sick the end of 2019 in the fall with something, and it ravaged our office. We all got sick, including me, with like a bad flu type thing. I mean, maybe, who knows? I don't even know if it's called, you could call it COVID or not. So when COVID rolled around in spring, nobody in my office got sick. I don't recall that. However, the fall, when COVID reared itself again, we all got sick. And there were some people who had that lung sound, there were a lot of people who had that lung sound, but, mild. We started treatment right away. Most of us got through it very easily. There was 1 or 2 that really struggled with it and took a little bit more work with it. I don't think anyone was hospitalized from our office. Certainly nobody died. And, you know, it's certainly nothing. COVID is serious business, man. This is not a walk in the park back then.
Yeah.
Now it's a lot easier, hopefully it continues that way. But it wasn't a walk in the park back then. But, we got sick like everybody else and treated each other. And I got sick. I treated myself right away with it. Like I said, I got 1.5 lungs. I got no IgA, and I got severe asthma. I was sick 3 days in the fall of that year when people were really sick with COVID. And, I got sick on Thursday night, which is the end of my work week. I was fine and, didn't miss much work over it. And, symptoms were gone. I don't know if I had it because there was no testing back then. But anyways, it's when I look back on, I remember, in the middle of that thing, with my partner, we're outside, it's late at night, we're tired, we'd be passing each other, running, mixing stuff and running with each other. And I said to him, Rick, at our deathbed, we're going to say, job well done with COVID. It was an honor to work with you during COVID. And I said, that's what we're going to say at our deathbed to each other. And that's the truth with it. And I'd say that with my nurses. I'd say that with my front desk. I'd say that with my patients.
You guys are truly heroes. And you made a great point. That was one of the biggest reasons a lot of people died, from what I saw, because the doctors like you who treat viruses and bacterial infections for years on a regular basis shut down and wouldn't treat COVID patients and said, go to the hospital. The hospitals don't treat viruses and bacterial infections. They treat broken bones and surgeries, etc.
And, what killed a lot of people too, I believe, was probably the isolation. People are locked in their homes. I got a nice house.
Yeah.
I got a lake view right over here. It's not I'm blessed, I'm lucky, and all that stuff. And I've worked hard for it. I got a nice view in my backyard. And, not everybody's got a nice view. Not everybody's got a nice house. Not everyone's got spacious rooms or whatever. And then they're stuck at home. They can't work. There's no interaction with people. And, liquor sales went through the roof. In Michigan, I remember, I don't drink much. I buy, alcohol usually for a present or something like that. And we have a local liquor store. And I, stopped in there once to buy somebody a bottle of wine who did something for me in the middle of that thing. And I said, how's business? He goes, oh, I can't even keep up. I said, what percent are sales up? He goes, 40, 50%. And,
people are drinking, which is destroying their health. They're locked in their homes.
They're trying to numb their anxiety and numb their feelings. And there's no human interaction anymore. And I wonder how much that killed people. Yeah. And you throw that in with COVID, it's a nice recipe for big problems, and the World Health Organization should have followed its rules for a viral pandemic, which was never locked down. And they said that from, before this, and then all of a sudden, we changed things and we're going to lock down until a vaccine comes out. And, unfortunately, that's what happened. Hopefully we'll learn from it and hopefully we won't do it again.
And you can't treat anybody any other way except for this and this. Now let's get into your treatments and kind of walk us through it. First, let's start with the IVs. Why is it important? Why are electrolytes important? And then let's go to the rest.
All right. So how about let's start orally first, because that was really the first thing we recommended for people. Perfect. So orally, we recommended high dose vitamins A, C, D, and iodine at the first sign of anything: sore throat, sneeze, headache, fever, whatever. So vitamin A, I would have people use 100,000 units a day for 4 days. Adults, these are adult dosing. For kid dosing, we use smaller doses. And vitamin C, I'd have them use 1,000 milligrams every hour orally of vitamin C, A, C, D. Vitamin D was 50,000 units a day for 4 days. These are all for 4 days, quick bursts at the beginning. And iodine. If people weren't on iodine, 25 milligrams of iodine. If they were on iodine, they would just double their dose for 4 days. And then after 4 days, go back to the original dose. So the 20-year protocol or 30-year protocol was vitamin A, C, D, and iodine. And then nebulizing, for those that had lung problems, with any of these viral or bacterial illnesses. It was nebulizing a dilute solution of hydrogen peroxide and iodine in saline. And they were instructed to nebulizing means to make a mist out of a liquid substance so you can get it deeper into the lungs. So a nebulizer just puts strong air currents through a liquid, and you hear bubbling, and you breathe it through a little mouthpiece. Those of us might recognize asthma patients when they can't breathe. They're breathing this mist of medication through a mouthpiece to try and open up their lungs. So I had them do a mist of hydrogen peroxide and iodine, which are highly concentrated in the lungs. Iodine has antiviral, antibacterial, antiparasitic properties to it. Same with peroxide. And peroxide is produced all over the body and in huge amounts in the lungs, and huge amounts when you're sick, as your body tries to clear these viruses and bacteria out. And I've used nebulized iodine and peroxide for people with lung cancer, for people with bronchitis, for people with COPD. One of my famous patients was I called him the blue man. He came to me, he was dragging an oxygen tank around. He had bad COPD, chronic obstructive pulmonary disease from smoking. And he was blue. Lips were blue, his face was blue. He looked like a Smurf doll almost. And so I put him on nebulized peroxide and iodine. He comes back like 2 weeks later, pink. And he's still using oxygen. He's still dragging a tank of oxygen, but he goes, I'm so much better. I'm doing more. And, I called him the blue man. That gentleman, he was in his late 80s. He took that nebulizer and that solution to a nursing home when he moved to a nursing home a year or two later. I went to do home visits for him, when he couldn't come into the nursing home. That nebulizer was front and center on his desk. And he did that till the day he died, in his 90s, and really felt much better and could breathe better. It was funny during COVID, when people in the nursing homes got COVID, I would talk to the doctors staffing the nursing homes. I'm like, ACD and iodine, and they need to nebulize hydrogen peroxide and iodine. Well, we can't nebulize. Why? Because it's going to spread COVID. I'm like, no, the peroxide and iodine should be able to kill COVID. Do you have any studies on that? No, I don't have studies on that, but they're going to be able to breathe better, and this and that. And well, we can't do that. The government, the edicts came out, no nebulizing. The hospitals stopped nebulizing because of that. It was a valid concern that perhaps when you nebulize saline, which is what they were doing in the hospitals, or albuterol, there's going to be no killing effect from viruses and bacteria. So you could theoretically spread it with that. But they couldn't do that, and that took away from that therapy. But those were the basic therapies that well over 90% of our patients did and recovered from and did well with. And then for those that needed more, we had them come in for IVs, and we did an IV of hydrogen peroxide and vitamin C. These were IV pushes. So we're used to doing IVs in the elbow, and they're bigger veins here, but we couldn't do that out of cars. It's too much reaching and too hard. So we'd have them stick their hands out the window and, put them in these small vessels. And, again, I told you my partner, Dr. Ng, was, a pioneer, and sort of, we tried this or that and the other thing to get these veins to pop out so we could do it. And he was an engineer in another life, because he was great with that. And, we were able to do it. And then for ozone, ozone was another part of that therapy. We couldn't do IV ozone out of the parking lot. It was just, you need an ozone generator, you need to bubble the ozone in, and it was too hard to do that. So we resorted to doing ozone butt shots. And so we would draw up ozone in 2 syringes, and, we had to give them butt shots from the car somehow. So, people didn't seem to care. They were sick, and they were feverish or couldn't breathe. No one cared. We'd have them stand up out of that car, or sort of lean over, open the car door, stick their butt out the car door. Old enough patients will remember American Graffiti, the mooning scene in that thing. And we were popping 2 syringes in their butt and giving the ozone, at the same time. Nobody cared. Wintertime, everyone's dropping their drawers, and I saw so many butts I can't even tell you. I by the end of that, man, I didn't want to see anyone's butt ever again. It was a really cool therapy, and it really worked well, and it really helped a lot of people. And we're still at it today. Now at least we can do it civilly and do it in the office. And COVID's not as severe as it was back then, and it's not, we're not seeing that lung involvement like we were before. So that's a good thing.
Yes. And you said you also used at some points you used steroids. Was it dexamethasone or what did you
So
guys?
we use steroids. We use injections of Medrol, or we didn't really use nebulized steroids much. We used IM shots, butt shot of steroids, and then we put them on oral steroids after that. We used that right from the beginning, and people definitely improved with that. And I remember the first edicts came out, don't use steroids because it'll inhibit the immune system. That's not true. We've used steroids for pneumonias, and short course of steroids stimulate white blood cells to release from the spleen and take away inflammation. I thought that was a nonsense argument right from the beginning. And, I saw the results of my patients. I wasn't going to withhold the therapy that I saw working for them right from the beginning. And then, they changed their mind on that one. And then we used IV fluids when they needed. A lot of people were not eating. They were, breathing. So losing a lot of fluid that way. And, they were dry and they were going to die from dehydration or have a stroke or something like that. And, we'd have these bags, these liter bags outside, it's cold in March in Michigan. And, we'd cover them as best we could. But so we'd be draining these liter bags, and man, by the time half of that liter's in them, the bag's cold now. They're getting like cold water into their veins. So we used to tell people, bring blankets, have enough gas in your car to keep it running and to keep the heat blasting on them. And we just made it work. And the patients, man, they were troopers. They stuck with us. We certainly didn't make any promises. And I'm blessed with the best patients in the world who, agreed and to walk down the path with me and, take a chance with me and my partners. And, they did it. And it was really, really wonderful, awful experience all rolled up into one ball all together. I mean, this man, I'd see these people who just couldn't breathe and their pulse ox is in the 70s or 80s, and they didn't want to go to the ER. We tell them to go to the ER. Pulse ox below 90, we tell them to go to the ER. You should go to the ER. They didn't want to go. The reports were 88% chance you're going to die if you get ventilated at that point out of New York City study. And so they wouldn't go. You need to treat me. I'm not going. I'll take it on, they just shake their head. No, they couldn't even say it. They're not going to go. So we did the best we could and treated them, and I thought we did pretty good with it.
You and your staff are truly heroes. I mean, there are so many that just refuse to treat. I understand the whole thing of not wanting to go to the hospital. I refuse to. Now, so if anyone listening now, this new wave of COVID, you said it's not as bad. What would be kind of first steps? Anybody listening, kind of, if anybody gets COVID right now?
I mean, the first step is, and it wasn't just take vitamin A, C, D, and iodine and nebulize. It was, hey, you need to clean up your diet, which you should have been doing beforehand, and cut out sugar. Sugar paralyzes the white blood cells for up to 5 hours. First thing I would do on the phone with people is stop eating sugar right now. No sugar, no refined carbohydrates. And second thing out of my mouth was, you need to drink water and salt to keep hydrated, keep your electrolytes up. Because the main thing, there were two main things that put people in the hospital. One was they couldn't breathe. And two was dehydration, making number one worse, or one making number two worse. I don't know which is which, but it made, it was 1 + 1 in this case was 4 or 5. And so if people could maintain hydration and maintain electrolytes, man, those people much less chance of ending up in the hospital. And we did our best with that. So the first thing they can do is take care of themselves and eat better. And then, look, you're sick. That's the time to support the immune system up. It's not the time to take in something that's going to inhibit the immune system, and give the immune system a chance. We were designed with this great thing that allows us to live into old age, hopefully, without dying from respiratory illnesses when we're young. We did that. No one would be here, and so when I look at drug therapies or I look at nutritional therapies, I'm looking for stuff that supports the body up when it needs a proper support. And that's where that vitamin regimen came in. I wrote a book on it called The Holistic Approach to Viruses. And it was all about treating, our 30-year history and primarily treating COVID. And it gives all the nuts and bolts of that and the dosing and that in there.
We'll definitely post a link to that below. Thank you for sharing that. Yeah, it's interesting you talk about the electrolytes because I wrote an article on that, and there has been numerous studies since I think 2021, 2022, and more recently that found those that had a higher mortality rate had just floored electrolytes. And that's, they were saying that's the first thing hospitals need to be treating or testing for are all the electrolytes, and giving people electrolytes like
They do test for that in the hospitals. But look, by the time these people are in the ER, their sodium is below 130. Look, you go below 130 in your sodium, seizures, respiratory problems, death can happen very quickly. And my patients know that I'm constantly harping on them who have low sodium that you need more salt in your diet, or they need their medication adjusted, their diuretics adjusted so they can hang on to a little bit more salt. Now, if you have congestive heart failure or kidney failure, it's a little bit of a tightrope to do that. People who don't have congestive heart failure or kidney failure can usually tolerate large amounts of salt, the right kind of salt, which is unrefined salt. I wrote a book on salt years ago because I find salt therapy incredibly helpful for patients, and it keeps them from becoming hyponatremic. So when you get, look, the worst thing that can happen is you're low sodium, you're hyponatremic, and then you get sick with something. These are the people who end up in the hospital. These are the people who get poor outcomes. This is a disaster. So the ERs do treat that very well, but man, you don't want to be there and have low sodium coming into that illness. That's just, if my patients could be in the background here, they'd be shaking their heads yes, because they've heard me talk to them. I saw patients today. I was telling them the same thing. Sodium's too low. And one of the indicators of low sodium is we should do an interview just on salt. Salt is such an important thing. Absolutely. One of the indicators of low sodium is you get muscle cramps or leg cramps or foot cramps. My feeling is you get a foot cramp or a leg cramp, you are low salt, period. End of story. You need more salt. The magnesium and potassium, there's other things that can help leg cramps as well. But boy, the first thing that I think should be looked at in the case of a foot cramp or leg cramp is what's your sodium and what's your chloride level. And the reference range for those are way too big. It should be tightened up at a little bit higher amount. Should be the optimal range.
Yeah, that's a great point. So that's something people can do at home, is just with high quality salt and increase their salt intake and clean up their diets. And now, how important is early treatment, and what do you define as early treatment as far as time frame?
Well, I can't even stress how important early treatment is. I mean, it was mind blowing to me in 2020 because there's no prevention, treatment, or cure for COVID. Stay at home, do nothing. We don't recommend anything. Don't even recommend diet changes. Don't even recommend cutting out sugar out of your diet. They recommend nothing. Just stay home so you don't infect somebody else. Well, staying home so you don't infect somebody else that's okay. Perhaps we should stay home, if you're feverish and coughing and sneezing. And, I don't think that's any news to any of us. Our mothers taught us that when we were younger, and, that's not quite a shock. But there's no research, there's no studies on supporting the immune system up when the body's sick. Yeah, that's nonsense. So early treatment was the missed thing back then. And early treatment, in my mind, lack of early treatment was responsible for a significant proportion of those deaths. Now, COVID is serious illness, man. People couldn't breathe. It was a terrible illness. It killed a lot of people. But I wonder if we would have just treated them early and supported them and given them fluids or told them to stop eating sugar, or, just told them to stay hydrated, maybe a little steroids and, maybe a saline nebulizer to help the lungs, just conventional stuff. I wonder how many would have not died from that. And we'll never know. But we do know that the recommendations of do nothing were not the right things to do. That's pretty clear, I think, from what's happened.
What's the kind of time window, would you say? As soon as you get sick, you should kind of jump on it?
Just as we talked about earlier. First sign of a cough, sneeze, fever, that you're getting sick. I mean, I know when it's coming. Vitamins A, C, D, and iodine, nebulized hydrogen peroxide and ozone, cut out sugar, keep hydrated with water and salt, and rest. And now rest. That's another thing. We were told to stay home. Don't do anything. I did this interview with Christopher. It was my biggest interview. That interview was translated into Arabic, was translated into a few languages. And I got that FTC letter right after that. And it was all over the world. There were over 1 million views of this interview. And Christopher, in the interview, I let the patient talk, and he was very eloquent. And, he talked about how he got sick with COVID. I don't remember if he went to the hospital the year or not, but I don't think he did, because I think he was afraid to go. And he locked himself into his room upstairs. His wife would put food outside the door, so he never left the room. And he basically stopped eating and and became dehydrated. And what happened with him was the neighbor was a patient of my partner's, Dr. Ng. The neighbor had a nebulizer, had the solution at home, and the neighbor who had COVID and got over it, the neighbor, heard through the grapevine or from Christopher's wife how sick he was. So Christopher's wife walked down the street, got the nebulizer, got the solution, brought it back home, put it outside his door. He started doing it. And he tells the story. His second or third nebulizer dose, his lungs started to breathe. Christopher called his doctor before this. Doctor said, just stay at home till you can't breathe, go to the ER. The same thing everybody else was told. And he's tearful, and I got tearful in his interview. And, he said, saved his life. So what was the question you asked me?
Like, as far as early
Oh,
treatment.
when to start. So when do you start? The first sign of anything.
Yeah.
When I get scratchy throat, or feel like a little fever coming or whatever, I know it's coming. I am starting vitamin A, C, D, iodine. I'm getting a IV of hydrogen peroxide and vitamin C, and I'm nebulizing. I may start the whole thing right off the bat. And perhaps the powers that be could have told us, clean up your diet, cut sugar out of your diet, so your white blood cells don't get paralyzed for up to 5 hours after you eat some refined sugar. Simple things that can be done that don't cost a lot of money. None of these supplements cost a lot of money. Nebulizer, you get a nebulizer for 40 or 50 bucks. The saline solution, cheap, can be bought usually at a drugstore, and a drop of hydrogen peroxide and Lugol solution is pennies. Really nothing is terribly expensive with this regimen. The IVs, fine, they're a little more expensive. Most people didn't need them. Most people did fine, on the oral stuff and nebulizing.
Now, as far as the vitamins go, not all vitamins are created equal. I would assume we need pharmaceutical grade or specific quality.
So I think that, the conundrum with vitamins and buying vitamins is there's no FDA oversight really of vitamins on the market. So, when you go buy an over-the-counter bottle of vitamin C, how do you know it's vitamin C in there? How do you know it's not sawdust in that capsule? We don't know. And interestingly, on some vitamins that you can check levels on, like the hormone DHA and pregnenolone, you can buy them over the counter. Years ago, I sent some samples of vitamins off that I can check levels on in the bloodstream and know exactly what's there. And, many of these brands do not have what they say is in them. And that's a problem. So try and buy from manufacturers that you trust, or better yet, work with a holistic healthcare practitioner who can guide you on what are better quality vitamins. And, that it is a little bit of a conundrum, but I don't know if we want full, a bottle of vitamin C is going to cost $100 if we start to have, regulations, on these things and certifications and all that stuff. And I don't know if we want that either, but, when you think of all the people taking vitamins over the counter and this multi-billion-dollar business, and no one's monitoring most of these patients' levels from taking these vitamins, how many adverse effects are caused by over-the-counter supplements a year? It ain't many. And there's certain classes like diet supplements that cause more problems than others. But, I haven't really heard too many reports I haven't heard any reports from anyone dying of vitamin C intake or
You're just
vitamin
getting
A intake or ACD, vitamin D intake. And, I just haven't heard many problems with that stuff.
Yeah. So work with somebody like you who knows which ones are good. Now, with the mainstream COVID treatments out there, are there any, in your opinion, that we should avoid?
We never used much of them because our patients got better. So I don't have any personal experience to say that, to say I tried this didn't work because we didn't use them. Remdesivir does not have a good track record. I'm not so sure that one should be used. Paxlovid if it's going to be used, it should be used in elderly only. That was a study out of Israel that showed some effectiveness. I think below the age of 65 in that New England Journal of Medicine study with Paxlovid, there was no help with it. So nobody below the age of 65 should consider it. And again, with our elderly patients, we didn't use it. Molnupiravir, I'm not impressed by the studies on that one either. I think those were the big treatment options with it.
Yeah. No, I experienced long COVID for 2 years, low energy, major lung damage because I didn't get treated until day 12, brain fog, plethora of health issues. And a study was done in the state of Alabama that showed about 13% of those who got COVID at the time experienced long-term effects. So in the beginning of the pandemic, going through all that, from your experience, what percentage of patients did you see experience long COVID?
We saw very few. And I would estimate that about 3% of our patients or less had long COVID because we treated them early. And I think that, you'd be the I don't want to say shining light. It's not a shining light because we don't want people, sick with long COVID.
Poster
You'd be
child.
the epitome of, the poster child of treat things early. And we just didn't see that in most of our patients. We had some, and look, we had some we struggled with. We sent some to the hospital, but usually those ones we sent to the hospital were late treatment ones and it started late and this thing had just sort of settled in. I don't recall med school where my dean and my professors and my instructors were telling me, don't treat people for this illness early. Wait till they get worse. I don't recall being taught that, and until this illness. And I think we're unfortunately still paying the price for it right now. And hopefully we've learned from it. I'm not so sure of that, but
yeah, I mean, I got COVID a second time and I took my doctor's protocol this time on day 3 and I didn't get long COVID. So but to me, that was enough to say, hey, early treatment, you won't get long COVID
and let me tell you, Christy, that has been our experience. Exactly. That's totally been our experience with it. And it would echo what we saw with our patients.
Now, mask mandates, do they work? What's the science? Do they do more harm than good? We're hearing all sorts of things. What are your thoughts?
So my thoughts are, if you're going to mandate something like that, there should be good randomized, blinded, maybe not blind, but randomized controlled trials on masking. You can't really blind people on masking because someone's going to know who's wearing a mask and who isn't. But what you could do is compare two populations, and we had the chance to do this at the beginning of the illness very easily and tell this state or this group, you mask, this one doesn't. Let's see how it turns out. We didn't do that. Now studies where they did that, the mass studies that showed some benefit, like the Bangladesh studies, there were so many flaws in it and so many problems with it. I never understood how cloth masks could help anybody, period. I never understood how basic surgical masks could prevent a viral infection either. The viral particles are just too small to do that. Now, N95 and K95 masks, they do filter out more than the other ones, but there's still holes here and air circulating through them. I don't understand how that can help with those small viral particles. And there's no great studies randomized studies that show that. I guess if you want a mask mandate, then we should mandate respirators that create a complete seal that filter down to much smaller than the viral particle for coronavirus. We could say that would probably help. But we don't have any studies for that either. So there's comparing countries that kept open like Sweden and their schools open to ours that closed them, and we had those mask mandates and kids didn't wear masks in schools in Sweden. There's certainly Sweden did better than us, but we didn't do better. And so I guess if you're going to mandate something, we should have good studies to prove that. And I don't think there are good studies with mask mandates out there right now.
Absolutely. Now let's get into prevention. One of my prevention strategies is taking an oral probiotic called Bliss K12. So I'd either take it when I'm going to be around a group of people and there's all this lots of research showing it's helped to actually prevent severe respiratory illness from COVID-19 and other respiratory or other illnesses like strep throat. So what are some other good preventative tips and strategies?
First tip is eat a healthy diet. Keep sugar down in your diet. Keep refined carbohydrates down in your diet. Call this the basics. Second thing is drink water, maintain hydration. Third is maintain adequate salt levels, electrolyte levels, and exercise. Those are great preventatives for everybody. We have an immune system. We should be able to deal with this. I'm 60 years old. I gave you my health issues earlier. We didn't mask up during flu season. I didn't mask up as a kid. You know, I remember in middle school, it was written about in my yearbook in middle school, like there was a day or two where over 50% of kids called in sick. I remember the hysteria back then. We thought it was funny. And I remember the teachers not showing up for work and demanding that there's shields put up so they can't see their kids or talk to them or whatever. And, you know, we got through it. So I'm not quite sure, you know, I think we need to lower the fear level down and, you know, do the basics, and people need to eat better. That's number one. And they need to, you know, do those other things I stated. And then, you know, correct nutritional deficiencies. So you're not going into an illness deficient in iodine or deficient in vitamin A or deficient in vitamin C. And then if the first sign of an illness, you know, start taking vitamin A, C, D, and iodine, nebulized hydrogen peroxide and iodine, and plus or minus getting an IV. But I think, you know, forget even the treatment part of it, just do the basics first. And if you get sick, your immune system should be able to handle it, and, you know, you get through it. I think that, you know, masking sick people, I don't know, man. You're going to decrease oxygen flow in them. You're going to increase carbon dioxide. What if they cough or sneeze? They're going to breathe that stuff back in. You know, that whole idea doesn't make sense to me. And do I think people need to cough on each other? No. Do I think a mask, if someone's coughing up stuff, and it'll keep the big particles out, but it's certainly not going to keep the little particles out.
Yeah. Now it sounds like there's going to be a new, I don't know if they're calling it a booster or a vaccine. What are your thoughts on vaccines as far as COVID goes?
Well, ideally there's efficacious vaccines and there's non-efficacious vaccines. You know, efficacious vaccines, you could consider the measles vaccine and chickenpox pretty efficacious. People who got the measles vaccine from 1963 on, there's no big measles epidemic in the US since then. And measles used to affect nearly everybody, you know, right before I was born in 63, before I was born. Chickenpox, I saw chickenpox vaccine come out. I was a conventional doctor at that time. I was a resident. And I remember when it came out, and I remember thinking, now I never questioned anything in medicine. That was the first thing I questioned. And I remember talking to my advisor about it. And I said, what do we need this chickenpox vaccine for? It's a benign illness for, you know, almost all kids. And, you know, the small percent who got pneumonia or encephalitis from chickenpox, are you really going to be able to treat, you know, a point some odd percent that get these conventional illnesses? And I said, I wonder if we don't get chickenpox, is that going to be okay for, you know, maybe chickenpox stimulates the immune system. I just remember talking to my advisor about it. And she's like, you know, I don't know. I don't know the answer to that. And I said, and chickenpox lasts, you know, 5 to 7 days, you know, kids stay home, they get better, and then they never get it again. And then I remember telling her, hey, the pregnant moms can present antibodies to the kids who got over chickenpox, so the kids don't get chickenpox when they're babies. I said, these babies are going to have problems if we do this vaccine, because who knows if they're going to get the same antibody protection. So I brought all that up to her. She looked at me and says, you're asking good questions I don't have an answer for. And, you know, I let it go at that point. But the chickenpox vaccine and preventing chickenpox, it's pretty effective. Now, there's other questions to ask. Is the effectiveness of the chickenpox vaccine outweigh the risk of getting shingles, which has gone through the roof, and shingles at a younger age? It's another discussion to have at this. But those are two efficacious vaccines at preventing the illness and preventing transmission of the illness. So the COVID vaccine, it was not studied originally to prevent transmission. My guess is it wasn't studied because they probably knew in the original studies of the animals that it didn't prevent transmission. And so they just didn't study it. So here we have a vaccine that 70% of Americans have got that doesn't prevent infection or transmission. And now, at the beginning of the COVID vaccine, there was a benefit that I saw in patients in preventing serious illness at the beginning. And that rapidly waned within about 6 months. And then that seemed to be gone at that point. Now, the illness seemed to get easier over time too. So now in my patients, I don't see a difference I see the vaccinated get sick as much or worse than the unvaccinated right now. And it seems to me, you asked me the question before we interviewed, that the vaccinated may be getting sick a little bit more than the unvaccinated right now. And I don't have any studies. It's just my observation of it right now. I'm not sure if that's the case or not. But either way, I don't see the vaccinated. It's funny when you think about a vaccine doesn't prevent infection or transmission, and right now it's not preventing hospitalizations. Now maybe it's not preventing hospitalizations because people aren't getting hospitalized with it, but there were studies from before that showed that there were some studies that showed vaccinated, when COVID was a little stronger, perhaps getting more hospitalizations than unvaccinated, but that has never been fully elucidated. And we should have been doing the studies. I don't understand what we spend our trillions and billions of dollars on. We don't have these proper studies being done. We're relying on other countries to do the studies. And it's really sad, and it's really unbelievable that, 2 separate administrations failed us in this process. And we have a Republican administration, maybe a conservative Republican administration that failed us, and we got a liberal Democratic one that failed us. And we definitely need a new pathway going forward.
Yes, we do. It's definitely been quite clear in my research how big industry, big pharma are very involved in government decisions. It's not great. Now, for those listening that would like to learn more about your work, your books, and any other resources you have, where can we find you?
So I have a website, www.drbrownstein.com. And, all the books are there, and, information is there. And, I would leave your listeners with, you need to empower yourself. You need to think for yourself. You need to I always tell my patients, look, I'm there to work with them. They're driving the car. I'm just on the side of the street yelling, go left, go right, go straight. They decide where that wheel's going. And they're responsible for their healthcare decisions. I'll be right with them, but they need to make their decision. They can't make a proper decision without without being educated. So if we've learned anything from this crisis is that who do you trust? And it's hard to trust people these days. It's hard to trust institutions these days. And you need to trust yourself, and you need to really think about things. And we've seen what happens when you just trust institutions, and it's not been pretty.
Very wise words. Thank you for sharing that. I will post links below to his website and his books and his resources. Well, thank you so much, Dr. Brownstein, for joining me again today. It was an honor to have you on, and thanks for sharing your COVID-19 protocol. And you and your staff are absolute heroes. We hope that more doctors listening will adopt these protocols. We need more doctors like you who are courageous and don't buckle under the medical tyranny that we're seeing today. So thank you again.
Thanks for having me. It's funny, you say we're heroes. I just kind of felt like we did our job. And it's what I went to med school for. And I remember at that meeting with our staff, I said, this is our time to shine. I said, there's no therapies out there. We know how to treat viral illnesses. I said, this is what I've been practicing medicine for close to 30 years. This is the practice for this very event that's going to happen. And, the practice was worth it.
Absolutely. Yes, that's what we're missing. We're missing every single doctor standing up like you did.
Thank you.
If you like this video, please like and share with others. This information could really help someone you may know. And if you haven't hit that subscribe button, make sure you do that. And I will see you all next Wednesday on the next episode of Discovering True Health.